drawing was done by Hans Baldung Green in the 16th century, and it is still a good guide to the diagnosis of depression. The turned-down corners of the mouth, the typical triangular very good fold over the eye, the furrowed brow, the hurt look. Depression is an emotion as old as mankind. Perhaps this is a reason why we sometimes fail to look at it as a disease, which it often is. Mourning and grief are human concerns, not clinical ones. But when there seems to be insufficient reason for the patient feeling so depressed, or if the symptoms are too severe, or if they last too long, then we are faced with a pathological depression, the typical symptom picture, and with the indication for medical treatment. It is a sad, despairing mood, which is the real core of all depressions. Depressions which will have to be recognized and treated like other clinical syndromes, for instance, shock or congestive heart failure. If we fail to recognize and treat depressions as such, nothing we do for our patient will help him. He may get worse, and there's always a danger of suicide in the background. Medically, it may be misleading. In the physiological sense, it describes a primary reduction of function. But in the clinical sense, it takes on a more complex meaning, and such opposites may be involved in the depressive states as excitation and inhibition, agitation and retardation. It matters little for therapy whether or not the depression falls into one or another particular diagnostic category. And for this reason, in this film, we are not so much concerned with differential diagnosis, but with the signs and symptoms of different depressive states.
This is a severe endogenous depression in a woman who has suffered previous manic depressive attacks. In general practice, depression seldom appears with this clarity.
When is it worst? In the morning, at night?
It's worse in the morning. It's on me now all the time.
It's worse in the morning, but can you sleep?
No, I'm too scared to go to sleep. I've had some pills. I slept last night a little bit. But,
with pills you can't sleep?
Yes, I slept a while last night before pills.
And if you don't get... You say you're too scared. In which way? Are you afraid of anything in particular? Or do you just feel so awful that...
I feel so awful all the time. I just concentrate on one thing, on myself, I guess, and what's happened to me. What's going to happen to me? What's going to go crazy? How I feel. I can't seem to talk to people. I seem to be dumb all the time. Can't do anything. Can't take any interest in life or even my family or anybody around. Just sit there, just like a dumb person.
This is also the face of depression, although it doesn't appear to be. Some people disguise their real feelings, and unless the physician is on the lookout for depression, it may announce itself too late. To miss a depression like this one can be as dangerous as missing a coronary.
Why did you come here?
Because I tried to commit suicide.
Yes, I knew that, of course. But what I don't know is why you tried to do this. Could you tell us how you did it?
I took an overdose of pills.
100, didn't you?
100, yes.
And why did you want to commit suicide?
Because I didn't want to face anything.
This wasn't the first time.
No.
How often did you try?
Well, I tried quite a few times.
Why did you try so persistently to take your own life? question?
Yes. I was just desperate, and I couldn't face things that had come up. So I thought the easy way out was to take pills and it would be all over. That's what I did.
You told me the other day that you have always made every effort not to show that you're depressed. Have you always made it a point to kind of cover up your real feelings?
Yes.
Why?
Well, I guess that's just part of me. When I was quite young, for a time I went to a stage where I was a real monster. I tried to get my mother's attention, which I couldn't get, and I would break things and cry and throw tantrums, and it didn't do any good. And then I realized that my aunts and other people could see how hurt I was, and I didn't want anyone to see, to be able to tell that I was hurt. So I just tried to be the opposite, I didn't care about anything. And it worked. People believed that I didn't care.
You learned to do it quite well.
Yes.
With an unmasked pathological depression, the signs are often clear, and a tentative diagnosis can be made quickly on the basis of what you see as soon as the patient walks into the room. In practice, these target symptoms may show themselves in a far more diluted form and may be missed unless they're deliberately looked for. Depression shows itself in the turned-down mouth, the inability to smile easily, the peculiar fold in the eyelid, the depressive cast of the face, the wry smile with no enjoyment behind it, the hurt look, the dejected attitude, the lack of spontaneity and animation in movement. Signs like these, even when far less apparent, should lead the physician to suspect depression. A few questions should clinch the diagnosis. When appearances don't help, the patient's verbal description of his mood and feelings must be relied on entirely. A symptom of depression is the inability to love anyone, to enjoy anything.
No, I can't concentrate very much, very little.
And you find any other kind of distraction? Going to a movie or...
No, I don't feel like. I usually used to like it very much to go to a movie, to play a game or something else. But now I have no desire, no feeling. I don't care for it.
Decrease in mental productivity and reduction of drive are characteristic symptoms of depression.
What happened? How do you feel?
Weak.
Weak? Are you tired?
Tired.
This is a smiling depression, so afraid of her depressive thoughts that she denies them even to herself. Because she must fool herself in order to achieve a composure that is not very deep, she may well fool her doctor unless he's on the lookout for the disease of depression.
What did you feel like doing when you were alone?
Usually I have to keep busy doing something.
Or else what would you be thinking about?
Oh, I don't know. I can't say. I can't say what I'd be thinking about.
What about when you thought about going to the basement and doing something to get rid of yourself? What about that?
I don't remember thinking about that.
You don't remember thinking about that?
No. No.
Do you remember telling me about that?
No, I don't. I don't remember.
What do you think when I
try to remind you of it now.
No, I don't like to.
Eh?
I don't like to be reminded of it.
You don't, eh?
No. I don't like thoughts like that.
Self-accusation and self-depreciation are common symptoms, and always present is the sad, depressive mood.
All my senses are dulled, but I think, I can't cry. I haven't been able to cry for months. I sometimes wish I could have a good cry, because I think it does you good, but I can't cry.
Would you consider it an illness?
Yes, but as I say, I think I brought it on myself. I know I'm stupid. I know it makes me mad when I can't do things properly. Not mad, but it makes me such an awful pity.
Why do you say you know that you're stupid?
Well, I do stupid things.
Do other people say it?
No.
Nobody blames you but you yourself.
A patient may look depressed and not be. Here, cerebral arteriosclerosis is responsible for what on examination turns out to be simply confusion.
Tell me, you know what day it is today?
No, I don't know. I don't see the calendar. I can say I don't see the calendar.
What month is it?
I don't know. I can say it because I don't see the calendar. I can say it.
Depression is the presence of a deep, profound emotion, not the absence of emotion. And what looks like the retardation of depression may prove to be the simple apathy of schizophrenia. The depressive knows no peace. The schizophrenic has no complaints.
How are you feeling, Jean?
Pretty good.
Not much wrong?
No.
You sleep well?
Yes.
Do you like the company of people, or do you like to be alone?
No, I like people.
You like music?
Yeah.
You like the movies?
Yeah.
Like parties?
Yeah.
Can you smile?
Yes.
The puzzled rigidity of the catatonic may look very much like the set features of depression, but the profound disturbance of depression is missing. There may be concerns, but there's something else again.
Why did you come to the hospital?
Worry, I guess.
Worry? What did you worry about?
Well,
What did you worry about? Have you forgot? Then?
Girls.
No girls. Early recognition of a depression in the consulting room is important before it gets covered up behind physical symptoms and complaints which the patient may produce in order to explain to his doctor and to himself why he feels as badly as he does. It is this failure to recognize a depression early which sometimes leads the physician and the patient down the long road of futile investigations and possibly surgery, which may prove costly and time-consuming, and to which the physician may resort when he is puzzled and cannot find the reason for his patient's complaints. This course of action exposes the patient to the dangers of delay in treatment, and in some cases to the risk of suicide. Certainly, elective surgery is contraindicated in depressive states because of the low general resistance of the patient. Very likely the post-operative course would be stormy. Not only are many psychosomatic symptoms attributable to what has been called depression in disguise, but also such behavior deviations as alcoholism or overeating, even delinquent behavior, proves sometimes to be the leading symptom of an otherwise concealed depressive state.
Puzzlement and bewilderment over their condition is common with patients suffering from pathological depression. They know something is wrong, but they don't know what or why. and they search eagerly for physical reasons to explain why they feel the way they do.
Right now, I have trouble with my stomach, which may be caused by nerves.
Do you ever feel discouraged?
Yes, I do. I have crying spells, which I cannot control. I have trouble with my stomach, which I believe is caused by nerves. Now, when I came here, I didn't know exactly what was wrong. They passed me to medical. All the medical was okay in every degree. And, well, I mean to say, it left me in the empty because I was in the impression, well, maybe they think that I'm making up the story or listening to myself, but I'm not that kind of a person.
Some patients suffering from depression, which has never been diagnosed as such, have gone from doctor to doctor, looking for relief.
You have been coming to the medical department for quite a time, eh? Yeah, you've had quite a lot of investigations, eh? You've had blood tests and x-rays and urine tests and bone marrow tests and everything, and they haven't found anything wrong.
And after it being the treatment, it's come 3 times a week.
Yes, you were coming to physiotherapy for a long time because of the pain in your back, even though they couldn't find out what caused it. How do you feel?
It's not feel bad, but it's not to feel like before.
When medical treatment has failed, some patients have been subjected to surgery time after time, with no effect on the underlying condition of depression. Depression is a pathological reaction to loss of something one has loved. It might be through death, or it might be through loss of money, of youth, health, or vigor. Anything that is meaningful to the individual.
Can you tell us how you were feeling when you first started coming to see me?
Well, I'd been feeling awfully depressed for a very long time. I cried over the least little thing. I felt that everybody was against me. And, well, I just couldn't seem to get along with anybody, that was all.
And when did this all start?
Well, I think it really started when I lost my baby. After my husband left me, I lost my baby. And then I had operations there. I had an operation for a hysterectomy. And it didn't seem to do much good. I mean, I began to feel more and more depressed. And then I had a 3rd operation there. I had my last ovary removed. And I was critically ill then. And then, I don't know, the place, everything around seemed to, just couldn't seem to get along at all. And then I had a piece of shrapnel in my knee, and I was asked to go to the Queen Mary Veterans Hospital to have it removed as I had a cyst. And while I was in there, I just broke completely down. And the doctor there suggested that I should come to the Montreal General and asked me if I was willing to undertake psychiatric treatment, which I did.
So you'd had 3 operations really before it was really realized that you were suffering from a depression.
Yes. Yes.
In old age and with chronic disease, the universal mood of the patient is often one of depression. The depression itself can be treated and relieved. Emotional comfort can be provided just as physical comforts are, with glasses or new teeth. Raising the mood of depression will allow the patient to enjoy himself again and will improve the handling of his condition.
Well, what do you feel like now?
Now I'm depressed. I was depressed. I was very happy always.
When did you get depressed?
For the months I tried to see you.
You think you'll ever get over that?
I hope to God I will.
This is a left-sided hemiplegia with congestive failure and diabetes. The mood is one of depression. Although objective improvement of her physical condition can be produced, the all-important feeling of well-being will only result when her depression is relieved.
I'm sitting in the window and cry the whole summer. I'm used to that. I'm used to the...
Do you cry a great deal? Do you cry often?
No, I cry like nobody hear what I am myself.
Oh, you cry inside?
Inside. I say, God, my God.
Old age is a rapidly rising problem, and with it is a rise in the incidence of depression. Depression has been called a disease of general practice and is seen but not always recognized in every consulting room.
What makes you feel better when you're feeling depressed?
What makes
you feel better?
I don't feel better.
Alcoholism sometimes results from self-treatment with alcohol in an effort to relieve feelings of depression, with habituation resulting.
Well, I took to the drink, you see, over being so depressed.
Depressed, were you?
Very depressed and melancholy at times, you know, has so much worry.
And when you go on these drinking bouts, I understand that it lasts maybe a week or 2 weeks or 3 weeks, and you drink pretty heavily.
Yeah.
Does it give you any relief?
It gives you the relief at the time, sir. You know, because I mean, say, it seems to deaden the feeling, you know, and you forget for a little while. But then when you come to in the morning, well, it's still with you.
In the background of all depressions is the risk of suicide, the overdose of pills, the cut wrists. Unless the depression is obvious, which isn't always the case, it is valuable to have the assistance of family or friends in arriving at the diagnosis. For without a history of the illness, it is difficult to know the change that has been wrought in the patient by the disease, and to know the normal condition to which treatment for the depression will return him. We are all so familiar with the feeling of depression that we tend to accept it simply as a condition of mankind, not an illness, which it sometimes is. An illness which can be treated and relieved. There is a great difference between the feeling of depression we all know and the one which is at the core of pathological depression, and only someone who's experienced it can describe it.
You were saying that it was strange to convince the doctors in the hospital that you were depressed, and they didn't think you were depressed because you didn't appear to be. Is that it? Even to the psychiatrist?
That is correct.
And how did you feel?
Well, I felt terrible because I couldn't see how I could possibly go back to work if there wasn't some improvement in my state. I couldn't see how I could possibly go back to work and keep going. I had stopped work to go into the hospital because I needed some treatment.
Mm-hmm.
And if they weren't going to give me shock or something, I couldn't see how I could possibly go out and work again.
There was nothing that you could enjoy?
Absolutely nothing. There was no one I could see that I'd be glad to see. There was nothing anybody could say
that would cheer you.
That would cheer me. Although, as I said before, I could still tell a joke.
Even then?
Even then I could tell a joke.
And make other people laugh?
Yes. Because I think the reason for that is that I'd always been known to be a joker, and I enjoyed the fact that people enjoyed me telling them jokes. And it would give them a good impression of me. I think that was the reason why I could still... I tried to muster up the strength to tell a story so somebody would notice me.
And you could do it?
And I could do it, yes, strangely. And then, in fact, some of the nurses remarked, how well I told the story.
And how good-humored you were, I suppose.
Yes. Although others didn't understand me so well and told me to get the wrong look off my face. There was one nurse in particular, of course I won't mention any names, but there was one nurse in particular who I didn't think really belonged there. In a hospital like that.
No.
Pardon?
Probably she didn't belong there.
Because I was sitting there and my face must have been a mile long, and she more or less criticized me for it. She this as much as to say, there's nothing wrong with you, what are you looking so glum about? And I half believe that. I half believe that she was right. That there was really nothing wrong with me. All I had to do was be a man and snap out of it.
And that made you feel worse?
That made me feel worse.
Yes. That's the sort of thing that people would do.
still do quite frequently. When somebody is depressed or looks that way, they say, oh, well, just snap out of it, and then the person feels worse because they think they should and they can't. Well, a lot of people, say, oh, I feel kind of depressed today. I think everybody has ups and downs through life, But there's no comparison. I had ups and downs before I ever had one of these depressions of which I'm speaking now. There are no words can describe the difference between it and the ordinary ups and downs that everyone has. Because in these ups and downs through life, you know that, well, tomorrow I'm going to feel better, the sun will be shining, and so on. But when you're in this type of depression I speak of, it doesn't matter whether it's a black at night or whether the sun is shining, whether it's pouring rain, or whether it's snowing or anything else, nothing looks good. It's all blackness. It's very difficult to put a thing like that into words. There's an old saying about this place called hell where bad people go to after they're dead, after they die, that the worst part about hell is not the flames, it's the hopelessness. And I think that is the part of hell that a person in depression really tastes. The hopelessness, that terrible hopelessness that comes over. Everything is black. Nothing. You can see there's nothing cheerful in anything. All I could see was death. For instance, I'd say, what's the use of getting up? What's the use of eating? I'm only going to die someday anyway. What's the use of doing anything? Because it's pointless. It's all going to end in death. Whether I arrange to do it to myself or whether I just sit it out